So we will come to the Kapalbhati. Kapalbhati is extremely good for improving the mobility of the internal organs. These organs and this part of the body doesn't move too much. So you inhale and expand your abdomen, and from that expanded state you just have a very gentle exhalation, and inhalation is happening automatically. Many yogis do it very vigorously, but for beginners and for the most people, the breathing practice should be comfortable, and it should be so. Kapal is head, Bhati means enlightens, because there is a 20-30% of the blood accumulates into this area, peritoneal area. And when you do this Kapalbhati, that blood goes to the heart and goes to the brain also. So it enlightens or brightens your brain. This particular practice may reduce age-related cognitive decline. It improves the massaging of the internal organs, including pancreas. It may reduce insulin resistance and diabetes. It sensitizes the diaphragm, so it's also known as diaphragmatic pranayama. And on the top there is diaphragm, on the bottom there are pelvic muscles, and the both sides are the abdominal muscles, core muscles. So this particular practice engages lots of muscles of the torso, the abdominal muscles, the diaphragm, the pelvic muscles. So let's do it for another 1 minute or so. Inhale. This particular practice may help us to melt the fat in the liver and in the abdominal area. Visceral obesity affects 10 to 30% Americans, and fatty liver is the same way. 10 to 30% people have a large liver because our diet is full of lots of calories. They are accumulated as fats into the liver, in the muscles, and in and around the internal organs. That's a major cause of insulin resistance and diabetes, and subsequently damage to the microblood vessels. Stroke and heart attack are the consequences of fat, which is here, adipocytes. They goes all around the body, and they lodge into the carotid arteries. They cause narrowing of these arteries. The blood is not adequate amount of blood is not going to the brain. That causes the cognitive decline. This is also known as a vascular dementia. So with these practices, this one particular, the Kapalbhati, will shrink your liver. You'll get excess fat out of liver, so you may do it 5, 10, 20 times a day, preferably before dinners or before lunches or before meals. You can be fully hydrated. I took a hot shower before I came here, so I'm enjoying the yoga practice more. Or you can use, you can use a heater in your area of this place. about 80 to 85 temperature, that magnifies the blood flow and relaxation, and you amplify the impact of the yogic practice of stretching and